means, as Dr. Harsh Mahajan in his speech he has said, that in the past decade, a lot of attention has been given to the social sector and especially to the health sector. This doesn't mean that I should say that previously, before 10 years or 11 years, it was an ignored area. No. But the priority, the prioritization was important. And in prioritization, how do we think, how do we go forward? That is very important. And what is the roadmap which we take? In the past 10 years, I can say that after 1997, when we had the health policy, in 1998, it was in 2017 that we developed a new health policy. Now, this health policy was not decided or discussed in Nirman Bhavan. This was discussed with all the stakeholders. We had regional conferences, we had conferences in the states, we had discussion with all stakeholders, and after immense consultation and keeping the health policy basics in public domain, we came out with the health policy of 2017. Now that is a landmark health policy in the sense it brings a change. What is the change? Previously we were thinking in terms of only curative health care. It was in 2017 that we started thinking a comprehensive health care. पहले हम सोचते थे बीमार पड़ा तो इलाज कराओ. हमने सोच बदली कि बीमार पड़े क्यों? Why should anybody, we should have a promotive health care. We should have preventive health care. And we should have early detection. So with this, we developed a comprehensive health policy. I'm discussing this because for the last, since yesterday you have been discussing about the best practices which you have been undertaking and sharing the best practices. But now when I come, it becomes my primary responsibility to share with you what is the thought process of government and the policy makers and your contribution into it. How do you contribute into it? So then comprehensive health policy, we develop preventive health care, promotive health care, palliative health care, curative health care, geriatric health care, and very important part was early detection. When we say accessible health care, तो access कहाँ मिलता है? Where is the contact point? So we expanded the base of health care. And for that, we developed 1.7 lakh Ayushman Arogya Mandir, which is the first contact. And in that contact, we tried to see to it that we are able to give them equitable healthcare, affordable healthcare, and accessible also. So we developed a scheme which we called as a community health officer, in which there is a community health officer, doctors, nurses, and that is the first point of contact. Now, when I talk, I also would like to share with you that this Ayushman Arogya Mandir has got 12 kinds of packages. We take care of eye and ENT, early detection of eye problem, ENT, ear, nose and throat. We take care of the dental care. We take care of the mental care. We take care of the hypertension. We take care of the diabetes, so that the early detection takes place. But the most important which I would like to share with you that we also provide free drugs and diagnostic facilities. And I would also like to share, because Niti Aayog is doing the third party audit of how the diagnosis and drug facilities are being provided to the common man. But the most important was the reproductive and child health care. This is one of the very important aspects for a healthy India when we are going for 2047, for a Viksit Bharat. And when I say so, I would like to share with you, because these things generally people don't know, or maybe if they know, they are not able to understand the importance, not I'll say importance, but the how it is bringing the change in the Indian health system. Every woman who gets pregnant, she is tracked by our system, which is called a mother and child tracking system by ASHA workers. Every woman. The day she conceives, from that very day, it is mandatory to have 5 antenatal checkups. And all this is captured. When she got her first checkup done, when she got her second checkup done, when she got third checkup done, in which month, all is captured digitally. And she has to be seen by one specialist in the whole process of before delivery. Another thing which I would like to share with you, that for high risk patients, it is mandatory to have 8 checkups, in which 3 checkups has to be done by specialists. All is captured by mother and child tracking system. We have a cohort of more than 5 crore mother and children. 5 crore at any given time. See the number and see how it brings the difference. So 8 checkups for high risk patients, 5 checkups for normal pregnant women. And then if I talk about vaccination, from child to 16 years, from the birth to 16 years, जब जन्म लेने से 16 साल तक. For 12 preventable diseases, we have 11 vaccines and 27 doses are given to them. And again, this is also tracked every month with an alert system. Every year. For 16 years it is tracked. Now you can understand that what policy makers have brought the difference for a healthy India. कि अगर हमको 27 वो डोजेस देने हैं और 16 साल तक उसको ट्रैक करना है बच्चे को, तो इट्स एंड यू हैव टू डू इट डिजिटली सो दैट यू आर, एंड इफ the mother does not come, or the boy does not come, or the girl does not come, the young child does not come to the facility, there is an alert system which alerts, and the ASHA worker has to go and remind her or him that you have to come and get vaccinated. And you have to ask the mother and the father of the parents of the child to see to it. So this is how we are trying to see that, and what difference it has brought. According to the National Family Health Survey, the 79% institutional deliveries have increased to 89, means 90%, reaching 90% institutional deliveries. Now how it is done? It is the responsibility of the ASHA worker to take the patient to the institution, get her delivered. If there is a complication, see to it that a complication which is being taken care by the government institution, and bring the patient back to home. Transportation is free. Incentives are given to ASHA workers for each delivery which she gets done in the institutional delivery. And this is because now we are reaching 90% of institutional deliveries. If I talk about MMR, maternal mortality ratio, according to the SRS, it was 130 per lakh childbirth. And now it is reduced to 88 per lakh live births. 88. There is a reduction in 42 points, which we have to understand. And all this has taken in just 10 years, in the past 10 years. And this figure I am giving is in 2021, not in past 10 years, in past 8 years. And now the figures will be much more encouraging if I talk about. If I talk about the infant mortality rate, it was 39 per 1,000 live births. Now it is 27 per 1,000 live births. And under 5 mortality, the decline is 42%. And the global decline is 14%. So you can understand that how India is answering the basic questions of the healthy child, and how we have to see to it that if I talk about neonatal mortality, the decline is 39% and the global decline is just 11%. That means with the speed with which India is going forward in the decline of the infant mortality rate and the neonatal mortality, that we have to understand. Of course, WHO has now also given a certificate to us that trachoma is no no more a public concern, and very soon, 1 year is left, we will be also out of the Kala-Azar. This is the third year of the where we are keeping an eye on it, and we will be very soon out of Kala-Azar. If I talk about tuberculosis, now this is also a very big public health problem challenge. Now, according to WHO, the decline of tuberculosis in India is 17.7%, and the decline globally is 8.3%, means our decline is more than double of what is the global decline. And if I talk about the treatment was 53%, and now the treatment has increased to 85%. And if I talk about the Lancet report, the Lancet report says that within 10 to 15 days, and the moment the person is detected with tuberculosis, the treatment starts at that very moment, that we have to understand. So this is how the change is being brought forth. Harshji also talked about the Ayushman Bharat. I become emotional when I talk about Ayushman Bharat because I am associated with it. What happened, I became the first time the health minister, it was in 2014. And India got the opportunity to chair the World Health Assembly. So I chaired the World Health Assembly in 2015. And at that point of time in World Health Assembly, the discussion was about the UHC, Universal Health Coverage. And I thought whether India will be able to, I'm chairing the World Health Assembly and we are talking about universal health coverage. Will India be able to give this universal health coverage, and how we can go forward? I came back, I made a plan, I went to Prime Minister Modi ji and I said that this is the plan. He told me, think something big. You are doing something, don't think in tits and bits, think big. And then we came out with Ayushman Bharat, which becomes the world's largest health coverage program. It is the world's largest health coverage program and health assurance program. And I would like to correct the figures. Now it is 62 crore people, almost more than 40% of the Indian population, which is covered with a 5 lakh rupees of health coverage. And now very important part is that every person above the age of 70 is entitled for a Ayushman coverage till death. You see, even the insurance company don't give you insurance after 60, 70. They also discourage. But our assurance starts only after 70 to all men and women and to all sections of the society, and without any financial distinction or giving them from any financial background is entitled for having this Ayushman Bharat. And if I talk about approximately 32,913 empaneled hospitals are there, and there, of course, when the scheme goes on, there are issues, which issues has to be addressed time and again, and it is a continuous process. And here, where I'm here with the private institutions, I assure you that certainly we are taking care of that also, and we are very much in the process of taking care of whatever the problems to come in the scheme. But this is the world's largest healthcare scheme, which we have to understand. If I talk about even in GST on 22nd September, the insurance part has also been taken care, and now we have got zero GST on the health insurance part, that we have to understand. If I talk about affordability, yes, Amrit Pharmacy, more than there are 240 outlets, and 6.62 crore patients have taken the advantage of it, and they have had the savings of 8,000 crore rupees as far as the branded medicines are concerned, where the rates are 50% less in Amrit Pharmacy. Amrit is the affordable medicine and reliable implant treatment program which we are trying to go forward. If I talk about Jan Aushadhi, we have got 16,000 outlets, and we are going to increase it to 25,000 outlets, and more than 38,000 crore savings have been given to the patients. This is how we are trying to see to it that how we can help the people patients and give them a helping hand. If I talk about the decline in the out-of-pocket expenditure in the past 10 years, from 62.6%, the decline is now to 39.4%, the out-of-pocket expenditure. And Ayushman Bharat has played a very important role in this process. If I talk about the medical infrastructure, of course, I agree with Professor V.K. Paul that we need 20 lakh beds in coming times if we have to match with the FICCI Bharat and at least 2 beds per 1,000. That is the target we have to set. But we have as far as the medical institutions are concerned, of course, we need doctors also. On the doctors front, as Harshji also said, at one point of time, we had only, by the end of this last century, we had only one All India Institute of Medical Sciences. Atal Bihari Vajpayee ji, the Prime Minister, created 6 All India Institute of Medical Sciences. And now we have got 16 plus 23 medical All India Institute of Medical Sciences, state of the art, that is being created. And as far as medical colleges are concerned, at one point of time there were 387 medical colleges. Now we have got 810 medical colleges. And the seats were 51,000. Now we have got 1,25,000 UG seats, and very soon we will be having in next 5 years 75,000 UG and PG seats increase in the next 5 years. And if I talk about the PG seats, it was 31,000. Now it is 76,000. So, and the last year 16,000 seats have been increased, and we are trying to see to it that the quality does not get compromised, and we increase the quantity also, because that is the need of the hour. And along with that, the paramedic staff has also to be taken care, and so on that account also we are working that each medical colleges should have at least matching paramedical courses which we have to give. As far as Digital India is concerned, you will be very happy to note that even America gives a certificate of Corona on a paper, and you get a digital certificate, and this is how we say that India is a digital India. Aadhaar card, as Harshji told, that 81 crore Aadhaar cards have been made, Ayushman Bharat health account, and more than 74 crores Aadhaar health records have been linked with Aadhaar card. So now the patients are not supposed to take all their documents, they are only to take their Aadhaar card, and they can share with the doctor. This is how we are working. As far as the e-Sanjeevani is concerned, it is providing teleconsultation from provider to provider, from doctor to doctor, and this is being linked with the medical colleges, and this is how we are working. As far as the e-Sanjeevani OPT is concerned, the consultation is between the patient and the provider, and this is how we are trying to see to it that our Digital India, through digitally, we are able to take care of the patients and give them the prescribed medicines which are needed for them. As far as UWIN portal is concerned, it has got a self-registration system for appointment. It has got QR-based vaccine certification. It has got SMS alerts for due doses, as I said, for mother and child trafficking system. And this is being translated into 12 languages. This is how we are working. And approximately 12.8 crore have been registered, and 52.5 crore doses have been recorded in the UWIN portal. So India is trying to see to it, and the Ministry of Health and Family Welfare is trying to see to it, that in the field of health, how digitally we can give relief to the patient, and how digitally we can take care of them. That is how we are trying to see to it that this health program works. As far as the expenditure part is concerned, I would like to share with you, we are very clear about it, that the 2017 policy says that we will be spending 2.5% of the GDP for the health sector, and we are now 1.8%. 1.8% we are spending on it. Here also I would like to share with you, funds is not the problem. Problem is the expenditure. The states should have the capacity to spend. Now we have, in the past 5 years, we have given 86,000 crores for PM Abhim, PM Pradhan Mantri Ayushman Bharat Health Infrastructure Mission. We have given them 65,000 crores, 86,000 crores. But as far as the expenditures is concerned, I have to chase the states. Bhai, kharch karo. Kharch karo. So we have to increase the capacity of spending. It's not that we can't put the money down the drain. It has to be spent on health in the right perspective. So therefore that is one challenge which we face. And yesterday also in the National Health Mission, I had to talk to 3 states. But you are not spending your money. Utilization certificate is not coming. And so next year your program implementation plan is going to suffer. So funds is not the problem. Problem is of implementation. And problem is of the rightful usage for which the states have to respond. We are trying our level best, but this is the issue. So there should not be in mind that India ka Bharat mein wo paisa ka thoda problem. No, nothing. ये माइंड से आप निकाल दीजिए. खर्च करने वाले बनिए, हम तैयार बैठे. राइटफुल खर्च करना है. ये कॉशन जरूर है कि राइटफुल खर्च करना है. नहीं तो कल को छपा होगा खर्च करो हम तैयार हैं. तो इसलिए मैं आपको आपके माध्यम से अपने शब्दों में कॉशन के साथ इस बात को कह रहा हूँ. As far as the 2 issues which has been raised by Dr. V.K. Paul ji, one is about the deregulation of the beds as far as that is concerned. Of course, the committee is working. We are open to it, and certainly if that is the need of the hour, we will be certainly looking into it. And as far as his concern about the family medicine is concerned, I am also very much concerned about it. It's a very, he has raised the issue very timely, and that has to be addressed, that needs to be addressed. And for that, we will sit with the IMA, the NMC, and all the stakeholders and see how we can go forward in that direction. But this is also the need of the hour, which we have to understand. As far as all of you are concerned, I would like to assure you on behalf of the government that we are open to suggestions, we are open to bring changes so that your best practices do not get hampered, do not get disturbed. And at the same time, I just wanted to share with you what government is trying to do in this field of health, so that we work jointly and understand each other's problems and their challenges and their roadmap. And when we work together, certainly we will be able to take care of a healthy India and a Viksit Bharat in 2047. I once again thank you all for giving me a very patient hearing. Thank you very much.
Thank you so much, Honorable Minister, sir, for those very inspiring words. And we also thank you, sir, for your continued leadership in shaping the future of healthcare in India. And we truly and deeply appreciate for your time and your support today. Thank you once again, sir. Ladies and gentlemen, once again, may I request you to put a huge round of applause as we thank our Honorable Minister, sir.